I'm Hester Prynne, DJ and licensed therapist. This is Music is Therapy. Your session starts now. People are talking about psychedelics everywhere right now. Ketamine, psilocybin, MDMA. Depending on who you ask, it's either the future of mental health treatment or it's like a 19-year-old at a Chemical Brothers concert in the 90s stuck in a K-hole. That was just the girl who lived on my hall in Oberlin. But underneath all the hype, there's something real happening. Doctors like today's guests are using ketamine-assisted psychotherapy for major depression, suicidality, and treatment-resistant mental health conditions. And music is a huge part of the experience, which honestly makes perfect sense to me because if you've ever had a song completely crack your heart open, or if a song has pulled you out of a depression for 3 minutes, like it has for me, you already understand that music changes consciousness. It's Mental Health Awareness Month, and today's guest is Dr. Priyanka Wali. She's a physician. She's licensed in every state in this country, a comedian and co-host of the podcast Health Stuff, which is also on iHeart, where they break down health and wellness trends with actual science, humor, and humanity. Dr. Priyanka Wali and I are going to talk about how ketamine-assisted psychotherapy actually works, why music matters so much in these treatments, and how songs can become emotional anchors for healing and transformation, right? My favorite topic. We also get into my own work with music connection therapy and why I believe/know that music can help people change how they think, feel, and act, whether they ever do psychedelics or not. And on that note, this Sunday, May 17th at 1 p.m. Eastern, I'm doing a live music connection therapy workshop on Zoom. My coach and collaborator, Lauren Zander, who you may remember from the podcast back in March, and who has really changed my life, she will be making a special guest appearance. The sign-up link is in the show notes. But first, here is my conversation with Dr. Priyanka Wali. What I want to talk about is ketamine therapy, because we started to talk about that on your show, and you come at it from a professional perspective. I have people in my life who are doing this type of work, but I don't know any doctors firsthand. I've never had a conversation like this. Is this the same ketamine that we talked about being in a K-hole at like the Prodigy show in the 90s? Like, I'm being silly, but I'm being real. Like, I remember being at Oberlin College in 1999, and the girls up the hall from me were like the first ravers that I knew. And I was in the bathroom, like the communal bathroom, and one of the girls came in, it was the middle of the night. And I was like, hey girl, what's up? And she was like, my roommate has been in a K-hole for like 72 hours. And now every time I'm around ketamine, which is like kind of a lot, I'm always like, is this the same ketamine that put her roommate in a K-hole? Like what's up with that?
So if someone was in a K-hole for 72 hours, first of all, if you, that's like not, I don't know how that, you would have to be continuously ingesting ketamine every 2 to 3 hours at very high doses to be in a quote unquote K-hole for 72 hours. Why? Because the bioavailability of oral ketamine is close to 20%, maybe 30%. If you have receptors that are more available, for example. So if you take 100 milligram oral ketamine lozenge, your body's actually only going to take in about 20 to 30 milligrams tops. And then the other thing is that medicine, by about 3 hours, 4 hours tops, if you're extra sensitive, it's going to wash out from your system. This is why ketamine is actually one of the few agents that can be used in breastfeeding moms, because the bioavailability is so low, very little ends up going in the breast milk. So
no way, really?
Yeah.
So a 19-year-old in 1999, notwithstanding, this medicine, which is now what we're calling this, right, is not something to be feared. It's something to be what?
Well, I have my doubts if in 1990 it was just ketamine. There might have been something else in it. And the thing is, I want to be clear that, there is abuse potential for ketamine. I don't want to say that there's no abuse potential, there's no potential harm. In fact, we know that chronic ketamine use can actually lead to inflammation in the bladder and can cause bladder symptoms. In fact, Elon Musk talked about this. Like he has done K so much that he now has chronic cystitis or inflammation in his bladder, which is one of the known side effects of recurrent ketamine use.
Wait, if you're listening to this, it's Mental Health Awareness Month. You or someone in your life is struggling with your mental health, severe depression, suicidality. You Google ketamine therapy in my town near me.
Yeah.
I just did it.
Yeah.
I just did it. It was effective. Mm-hmm. Now, the idea is you go to a clinic or you go to a treatment facility, and it's ketamine-assisted psychotherapy. What goes on in this work?
Yeah. So first of all, generally in a CAP session, what's really important is the preparation before the actual dosing and then the integration after the dosing itself. That's where intention setting is set. Generally, every CAP session, you go into a CAP session with a plan to ask yourself a question about what am I doing here? Why am I taking this medicine? It's important to have a general intention, but not stay married to that intention, because of course, in these psychedelic spaces, anything can happen and you're not trying to control the experience. You're just trying to be open to what unfolds.
So what might that be? Give us an example of what an intention might be.
So lots of examples over the years. Let's say someone suffers from depression and they, this is an actual case. Someone was suffering from depression. They never experienced joy, or they couldn't remember the last time they experienced joy. And so going into that intention, their intention for that session was to teach me about joy. And what came up were actually things that they didn't realize were a part of their life, but actually they did feel joy. They just didn't recognize it.
Like what?
It was small things, like their coffee in the morning, they're hugging their child, laughing with their partner. These were things that were already a part of their life, but it was just the shift in perspective around recognizing that they do feel joy. And it's not like that they live a life where they don't feel joy. And again, it's about, I've said this before when we had this other conversation, it's not necessarily about feeling better. It's about getting better at feeling. So their relationship with their depression changed because they always viewed their depression as the absence of joy. But after that experience, they realized that actually there is depression. They do feel sadness, but it sits alongside the joy that is in their life. And there's a nuance
not the only
there.
Feeling.
Yeah.
Okay. So this person comes in has feeling, is that anhedonia? Is that what we would call the ability to feel
I think that would be fair to say. Yeah. Anhedonia, like
Anhedonia.
not feeling anything. Yeah.
Yeah.
No pleasure.
And so no pleasure. And so they come in and tell us what the process is like.
Yeah. If anyone is coming in with depressive symptoms, the first thing I do is do a thorough medical screening to rule out reversible nutritional causes of depression, of which there are many. It doesn't, for example, if someone has depression because of an underlying iron deficiency, it doesn't matter how much ketamine you give them. If you don't correct that iron deficiency, they're still going to be depressed. So then once they're prepared, the first thing we do is a thorough intake around their history, whether it's a trauma history or depressive history. And then we focus on setting the intention, which I just talked about. Once the intention has been set, we sort of set the session. We sit down. We always start with some sort of grounding practice, a breathing exercise, depending on the client's frame of reference. If they come from a spiritual background or not, we sort of tailor that accordingly. And during this entire time, I'm playing music. And the music is actually a critical part of how someone's going to respond. In fact, there's published research that calls music actually like the hidden therapist. Yeah. It is a central therapeutic component to how someone's going to do, regardless of the drug dose and the intensity.
Say more about this and tell us what kind of music works and what do you choose? And you curate this. You curate this music yourself.
What's really actually important and what the studies show is that the music really needs to mirror the onset of action of the medicine itself. So slow music in the beginning before the medicine's kicking in. And then as the medicine starts to take deeper and deeper effect, the music should actually mirror that depth. And that's actually called resonance, when there's harmony between the music and their emotional state. And there's research that shows that the patient's resonance is actually significantly correlated with whether or not they're going to get insight. So
Can you tell it? This is so interesting. I want to slow this down.
Yeah.
Because this is just so exciting to me.
Yeah, it's like taking what you do and like putting it on steroids.
It's putting it on ketamine.
Yeah.
So I understand we got a slow build. So you're maybe doing things with what? Music beds or pads and not vocals or maybe chanting.
I actually lean on a lot of EDM type styles of music. There's a lot of modern sort of synthetic sounds, drums, and depending on where in the session we are, like in the beginning when we're doing the grounding exercise, it's very sort of light, airy, kind of breathy, gentle stuff. And then when you administer the medicine with intramuscular ketamine, it has an onset of action within minutes. So you're kind of flying pretty quickly. So that kind of peaking is very sort of predictable and can be used to tailor kind of the increasing beats and moving on from that.
So this isn't about using organic sounds that people really play. When you talk about the onset piece, you said there's resonance. We want more harmonics and we want faster BPMs. You're choosing songs that have more harmonics, I suppose, and faster BPMs, but not necessarily human-made.
What's key is that there's something about the ketamine as a synthetic medicine kind of mirrored also with harmonic synthetic type music.
Interesting.
Yeah.
And this just cleared something up for me.
Okay.
I think, which is that, this, what do we call this? A medicine? It's like, sometimes I feel so goofy saying that, like I'm trying to be cool. Like I did ayahuasca a couple of times and I'm like, the medicine is the reason I have my daughter, but that's actually true.
Uh-huh.
When we do things like ayahuasca, right? This is an organic substance and the music was all human made. I mean, it was live, it was organic, it was drums, it was singing, it was all of this. But ketamine is a medicine that's been associated with, dance music since its inception.
Exactly.
I mean, since its modern inception, we don't need to debate which city created dance music. I'm not trying to have a Detroit London fight right now.
Yeah, that's not my
what
jurisdiction.
the show.
Yeah,
that's not what the show is about. And
Yeah.
eight other cities come at me. But the idea that the synthetic beats match the synthetic substance is very, very cool because it sounds like it's almost a way to internalize, put the music in your body.
Yes, exactly. And that goes back to that point of resonance, right? It creates a sense of harmony between what you're emotionally experiencing and the music itself. I have had ketamine experiential sessions in therapeutic settings, so I understand what this kind of state is like. And as a medicine, it's a very strange state. It creates a very strange sort of experience. It's certainly otherworldly, but it's also can be a very healing and beautiful experience when done in the right set and setting. And I think that's what's key about the music, that this is very beautiful music, but it has almost like an otherworldly type of nature to it.
You go somewhere else.
Yeah,
so
you definitely go somewhere else.
So tell us what happens. Like, tell us about the rest of the session.
A lot of times with intramuscular ketamine, it's generally a deeper and sort of quieter experience. There, in the beginning, there's generally not that much conversation. In fact, they can't really even move their bodies.
So if you're not talking to them about the suffering, I suppose, how is it working?
we don't actually start breaking down the experience until the next day. Why? Because there's still consolidation happening hours after the ketamine is out of their system.
I was told by a clinician recently that when you have a ketamine experience or journey or a healing session, however you call this, right?
Yeah.
The night before, and if you go to a therapy session the next day, a psychotherapy session like I do, your neural pathways are sort of primed for, like, you're primed to pop a new synapse. You're in a very flexible, I know, me too. I just made that up. I'm like, how else do you say this? But the idea is that you're in a very flexible headspace. You're open to new experiences and ideas. And essentially, you're interrupting the patterns and primed to create new ones.
So integration, in my opinion, is actually more important than the dosing itself. This is, to your point, where the neural pathways are sort of being reestablished. This is where you're then challenging the perspective. So, for example, the way I like to think about it is that medicines like ketamine or any other psychedelics, they are not changing you. These medicines are just opening a window for you to see things differently. But it's up to you whether you actually want to take that window and keep it open.
For people who aren't going to do ketamine,
yeah,
let's say, what do you think they can learn about how to listen to music from the type of work you do?
I mean, I fundamentally believe that music itself is medicinal in nature. And if a person can get into an open state, you don't need these medicines, by the way, to get into an open state. Like, there are other ways to be open, whether it's something as simple as going out in nature or waking up and gazing towards the sunrise. These things are free. They cost nothing, and they can create a state of openness. And we know our breath can, with breath work and deep breathing and different types of breathing, we can create open states that, from a brainwave perspective, mirror psychedelic states. If you are open, and it creates this sense of acceptance around allowing the music to have an impact on you, because the music can then actually, it's suggestible. It creates a sense of suggestibility. And in that space, where you're combining suggestibility with this emotional openness, I mean, that's where you get breakthroughs. Yes.
Give us an example of how to do that.
My personal favorite is I like going for walks outside. I like touching trees. And if I put on a pair of headphones while doing that, it can, for me as a sensitive being, can be a very intense experience.
Do you set an intention before you do that? Are you like, I'm going to go on this walk to work out this? Like, I remember going to yoga and like working it out on the mat when I was going through a hard time in my life, 20 years ago. And we would do that. We would say, this is what I'm working out. When I go to the show, when I go to a dance show, I went to see Peggy Gou on Saturday. It's a Korean DJ, amazing,
nice.
Incredible. Really like consistent, like quick, fast music. Like, you're really just dancing, like, it's not song driven. And I set an intention for what I was going to leave there. I was like, this is what I'm leaving here. And I did that totally sober on this day, right? Mm-hmm. Can you set an intention and just listen to this type of music that you're using in the ketamine-assisted psychotherapy and get some of the benefits without actually using the medicine? Yes,
100%. In fact, in my training, we would do, as part of the training, they would have us sitting down, lying down with an eye shade over our eyes. That's something I actually forgot to mention in the session. There's an eye shade over your eyes. And they had us listen to the music without taking any medicine. And I experienced it as a very moving experience. And so, I completely think that the music alone can definitely lead to a feeling of, some sort of motion within.
This work is very exciting to me. I've had some experiences with ketamine. They've never been like this. They've always been kind of out, and I've done it in a ceremony. But I've never done this in a way where I think I've actually, now that I'm remembering, I think I was actually told to set an intention, but I don't think I really I don't really think I knew how to do this.
Yeah.
But the way I do it with music is like this. Think of the Talking Heads song, Once in a Lifetime. For me, and I think in generally speaking, we think this song is about like growing up, moving to the suburbs, making choices, and even telling you this, like, I'm going to start crying, you see? Because I've used this song so much. The song is about what happens when you make choices and the feeling of the choices you didn't make. It's about getting older, But when I play Once in a Lifetime, because I play it a lot, it's like, I think it's 118. It's right in the middle of a lot of different genres of music. People like it. They know it. It's a throwback, but it's cool. It's modern. It's old. It's, David Byrne. It's always awesome. So I play it all the time. But when I play it, what I do is I take 3 minutes or a couple minutes for myself. And I bring up the feelings, all the feelings that just came up when I said the name of the song. Yeah. And I guess meditate on them or move, like you said, I move them through me. Because I have grief around those things, as does everyone my age, right? Yeah. And so I visit with that, and I let it out, and I breathe, and I dance, and I sing the song, and nobody really knows the difference, although maybe now people will see me DJing, I play this song. And then the song's in that container, and I close it up, and I move on, and I work on that. That's one of the things that I work on. It's not suicidality, it's not, severe depression, but it's something that I grieve, and I think many people in middle age do.
Sure.
I'm so interested in the work you do, and when I think about bringing music to it, I can only think of bringing like a David Byrne record to it. But I agree that we don't want to be sort of telling people what to do, and the songs that I use are very topical and they're very lyric driven, right?
Right.
And so I'm not sure what I think there's a huge opportunity there, but I'm not sure what my place is in your world.
I do think you have a place. You might even be overthinking it because you're already putting people in these heightened states. And if anything, one could argue that you're actually doing it without medicine, which puts you're like that powerful that you can do it without the use of substances. I think there's something really important to that. But I would invite you to keep asking yourself where your place is. And I can't wait to see how things will unfold for you. I think your contribution is already so important, but it will continue to just amplify.
That's so nice, and I so appreciate that. I'm like letting you flatter me. The music is the medicine, right? It's
the
like
music is the medicine.
The music is the medicine. The reason I became a licensed clinician, which I will take any opportunity to remind folks everywhere I go, my family, my patient, you gotta listen. This license didn't come cheap. But the reason I became a licensed clinician is that I can be in a room with you. Exactly. You can't be a spiritual DJ and maybe you can. I don't think you can be a spiritual DJ and have a place like this, but I can have a place with you because I'm a clinician, and that's a huge honor. I'm so proud of myself that I did that, because I feel like I can talk to you about this. Like, this is very special for me, and thank you for being here. That's what I'm trying to say. I have to tell you, this conversation makes me feel so young, because it's like the work you're doing is really, it's young. I mean, it's so cutting edge. It's the newest, most exciting part of mental health for a lot of folks. Certainly. I mean, it really just is. And it makes me feel like I'm just getting started in my work. Like, that's an exciting thing, to be turned on by healing work as if you're just getting started. Huge thanks to Dr. Priyanka Wali for being here. Go check out her podcast, Health Stuff. It's smart, funny, grounded, and really human in a space that can sometimes become very noisy and extreme. And if today's episode resonated with you, please share it with someone who you think needs to hear it, or rate it, leave a review. That's how we grow. This month's playlist, Songs That Hold the Feeling for You, is in the show notes, along with the link to my live music connection therapy workshop happening this Sunday, May 17th at 1 p.m. Eastern on Zoom. My coach and collaborator, Lauren Xander, will be making a very special guest appearance. And as always, if there's something you're struggling with, something you're trying to process, move through, or even a feeling that you just can't quite explain, please email me at musicistherapypod@gmail.com. I may just have a song for you. Thanks for listening. I will see you next week. DJ Hester Prynne's Music is Therapy is a production of iHeart Podcasts. I'm your host, DJ Hester Prynne. Our executive producers are Marissa Bramwell and Jonathan Strickland. Our associate producer is Jonathan Klopp. Our marketing lead is Allison Cantor-Grabler.